in putting this content together. And so they'll be dipping in and out as well and helping in terms of the delivery of some of the content. So, and we really want your feedback throughout. So do use the chat with questions, please, or comments. As I said, we'll have a breakout room as well. And at the end, time for questions as well. Okay, so this was funded by What Works, and it's part of a bigger piece of work that the Home Visiting Alliance are working on, and the title being Delivering the Best Outcomes for Children and Families Through Home Visiting. And I suppose what we really wanted to do with the training is to create a culture of inquiry in everyday home visiting practice to grow learning and establish what we're calling a dynamic evidence base, which could guide current and future practice. Okay. And as I said, the Home Visiting Alliance Executive are busy working on what an outcomes framework for home visiting might look like, and teasing out all the elements of that, the pieces of that, a logic model, which we have a draft of and which we can circulate at the end of the session for you to have a look at and send us your feedback on. But also then what sort of data we need to collect to establish an outcome, to inform an outcomes framework, and then therefore an evidence base for home visiting, and the range of different data that we might need to collect and report on, from output data, engagement data, indicator data, and obviously outcome data. So that's the purpose of the overall aim of the What Works initiative. Excuse me, I've got a bit of a croaky throat today, so just bear with me. And there's a couple of steps involved in that. As I said, the Home Visiting Alliance are busy working on that as a collective, and they're going to be consulting both through this mechanism, but also having another session, hopefully towards the end of January, where we'll invite people to come and consult on the draft outcomes framework. So we're also, part of that process is obviously hosting this session in November with yourselves. And we were also planning 3 sessions for home visitors and their teams, so that, you know, and this is why this session is so important, because we can learn from yourselves what is it that you feel you would need as a home visitor leader in order to support the delivery of an outcomes framework within your team and your local areas. So we're planning 3 sessions, as I said, February, March and April of 2025. And it's always that balancing act of how much training can we offer in one go, and you know, not overwhelming people with too many demands on their time. So much has happened in the world of home visiting, and just to make sure we're all on the same page, we're all coming from different perspectives. Some of us know all this already and some of us are less familiar, but so much has happened in the last 5 years nationally in terms of home visit, from the first 5 commitment, which was to explore an approach to home visiting services. And really, I suppose it's a real credit to the department and to their partners, TUSLA and the HSC, in moving through those implementation actions of first 5 and delivering then on national research, including the Maynooth Unites National Review, putting this content together, economic case, and so they'll be dipping in and out as well, and helping Alliance also in terms of the delivery of some of the content. But also we now have and we really want your feedback throughout. So do use the chat both with questions, please, or comments. Fantastic. We have as I said, we'll have a breakout room as well, program manager Caroline Sheehan, time for questions, and our data officer Thomas. Okay, so this was funded by What Works. So again, it's part of a bigger piece of work that the Home Visiting Alliance are in Ireland working on, and the title finally delivering the Children's Fund for children and families through home visiting. Many of you may be familiar with. What we really wanted to do with the training mark is to create a culture of that was launched this year and has a particular focus on families at risk of poverty, grow learning and establish and what we're calling a dynamic evidence base 5 years, which could guide main objective of that is to increase the availability and accessibility of evidence-based home visiting services nationwide. So we really are Home Visiting Alliance executive are busy working
securing
on
the future
what
of home
an
visiting
outcomes framework for
in
home visiting
Ireland.
might look like.
And that's against
teasing
a
out
wider
all the
backdrop
elements
in terms of
that,
outcomes, and
pieces
everybody's
of that,
familiar
a logic model,
with Bob F,
which we have
now
a draft
Young Ireland,
of, and which we can circulate
and also
at the end
the
of the
department
session
have
for you
been
to have a
very
look
busy
at
working
and
in
send
terms
us your
of under
feedback
what
on.
works.
But
Range
also
of different
then what
resources,
sort of
really
data we need to
supporting
collect
organisations
to
in
establish
effective
outcome-focused
organisations,
framework,
and
the
then
establishment of the
therefore
what
an
works
evidence
for
for
home
home
visiting
and the
as
range
well.
of different
So
data
really
that we
a
might need
lot
to collect and report on.
of focus and attention,
output data,
supporting
engagement
us all
data, indicator data,
to work more
and
efficiently
to establish our evidence
So that's
base
the
and to have a
purpose
clear
of
focus
the
on
bigger,
outcomes.
the overall aim
And while
of
it is
what works
just
initiative.
come to
Susan
its
might
end,
got a bit of a
to
croaky
commissioning
throat today,
framework,
so
there's a real focus
just
on
bear
that
with
to
me.
move to having
And there's a
more
couple of steps involved in that. As I said, the Home Visiting Alliance are busy working
evidence
on
base
that
and at the highest level.
as
at
the moment,
and they're going to be
consulting
through
from
this
mechanism, but
mechanism,
also having another session, hopefully
to
towards the
funded
end of January,
organisations or
where we'll invite
programs.
people
Only
to come and
2%
consult
have the highest
on
level of evidence.
the draft,
so we can see how challenging that is, and how
so
we might want
we're
to
also
move that
part
forward.
of that process is
have
obviously
evidence
hosting this
base
session in November with yourselves.
Of all our work.
And we were also planning 3 sessions
And
for
so
home visitors.
what
and
does
their
this all mean
teams,
for us all, I suppose,
and
and
why
this is
are
why
we
this
doing
session is
this
so
at
important,
all?
because we
Why
can
are we
learn
focusing on
from
outcomes?
yourselves
And
what is the difference does it
you
make? We're all
feel
very, very
you
busy
need as a
delivering
home,
to children
home
and
families
families
leader
in order
in
to
our
support
day-to-day business.
the delivery
And I
of
suppose
an
the
outcomes
question
framework within your team
is
and
why
your
are we
local
doing
areas.
this? Is
So
really
we're
planning
how
3
do we know
sessions,
we're actually
as I
making a
said,
difference?
February,
Our
March,
lives can be
April
so
of
busy
2025.
delivering,
And it's always
and
that
doing
balancing
that
act
we
of how
often
much
never
training
pause
can
and
we
stop
offer
in
and
one
think,
go, and
are
not
we
overwhelming
making a
people
difference?
and what
Too
do we
many
mean by
demands
that?
on their time.
Really, is anyone better off?
So much has
from
happened
our
in the
work
world of
that
home
we're
visiting,
doing
and just
in home
to make
visiting?
sure we're all
And
on the same
really
page, we're all coming from
pausing and
different
taking the
perspectives.
time to
Some of
think
us
about
know all
that,
this already, and some of us are
and
less
it's
familiar.
probably not something
But
we
so
get the
much has
time
happened
to
in the last
do,
5
and that's
years
where
nationally
the
in terms
torture of
home
doing
visit, from the first
actions
5
like a logic
commitment,
model really
which was
do
to
afford the
explore an
time to
approach
think
to home
through,
visiting
and hopefully
services.
that's the
And
space we
really, I
create
suppose, it's
here
a real
today
credit to the
think through
department and to
what
their
do we want to
partners,
achieve,
to
and
the
is anyone
HSC,
better off by
in
our
moving
work?
through those
And I
implementation
suppose
actions, the
why
first
you
5,
as
and
leaders
delivering
and
them
managers
on national
and
research,
coordinators,
including the
really
minute,
you guys are the
Unites
essential
National Review of Home
as I say,
Visiting,
I sometimes
and the
say
economic
the
case
pinch
for home
point,
visiting in
the real
Ireland, and then
core
obviously the Home Visiting
of
Alliance
making
also
a
have their
difference in
feasibility
terms of both
study.
supporting
But
your
also we
team,
now have the appointment and
creating the right
Caroline and
culture
Thomas,
for
I think,
how
are both on
a
the
sort of
call
an
here,
outcomes
which
focused work
is fantastic. We
would
have the
happen,
appointment
but
of
also
home visiting program
feeding
manager
what we
Caroline
know is
Sheehan
important for
and our
children and
data
families,
officer Thomas, who's
and
also
protecting
on the call.
that
So
as we
again,
move,
another
as we look
major
towards something like an
milestone in
outcomes
progressing
framework.
home
We're
visiting in
also there
Ireland.
to receive
And
to
finally,
share up
then
and down
the Children's
that sort of
Fund,
knowledge. So
really,
which
those
many of
of
you may
us
be
on the
familiar
call
with,
who
and
are
I'm not going to go
leaders
into too much
and
detail on that,
coordinators
just
of
to
home
mark it as a
visiting programs
milestone
are
really essential
that was launched this year
to
and
making
has a
sure that we
particular
do this
focus on
well, that we
families
do
at
this
risk of
right,
poverty,
that we need to listen
and
both
the
top
the
up and
period of
bottom
funding
down
for the next
so that
5
we can
years.
do
And obviously,
this in
the
the
main
best
objective
interests
of that is to
children and
increase
families we
the
work with.
availability and accessibility of
So it's really
evidence-based
great
home
that we have
visiting
so many of
services
you on the
nationwide.
call
So
here today.
we really are at
But we
a
also
great
need to
stage
work with the
in
leaders,
securing
our
the future of home visiting.
interagency partners,
in
our TUSLA
Ireland.
stakeholders, our HSE
And
stakeholders,
that's against
who are
a
also
wider
leaders
backdrop
in
terms of
supporting us
outcomes,
and
and everybody's
creating the right
familiar
culture
with Bob
both
F.
internally in our
now Young
organisations,
Ireland,
but also within local areas,
and also
so
the
that we
department
can
have been very
deliver
busy
the right
working
outcomes for
in terms
children
of
under what
families.
works. A
And
range of
I
different
suppose
resources. Really,
I don't know if many of you are
supporting
familiar with The Wire,
organisations in becoming effective,
Barack Obama's famous favourite
TV drama series, and the
it's
establishment
one
of the
that's
What
not
Works
possibly
Evidence
for the
Hub
faint-hearted
as
in
well.
terms
So
of
really a lot of
definitely got an over 18s rating,
supporting us all
but it's so much more than just a gangster drama
to establish our evidence base,
Barack
to have a clear
Obama's
focus
favourite.
on
It very
outcomes.
much looks at systems.
And while it is, and I suppose
I'm
come
just flagging
to
it
its
here.
end,
We are going to
the
talk about
two-sided
commissioning
systems
framework
as well throughout
there's a
the
real
session.
focus on that to
But
move
in
to
the
having
Wire, you've
more
got
school
TUSLA-funded
systems,
programs
police
to
systems,
have
the
a
legal
level of
system, as it
evidence
were.
base
And what we
at the
find
highest
is
level.
even though
So at
they
the
are
moment, gathering
those
data and gathering
Standa Tusa Commission children and families
still fall through
funded
the net.
TUSA-funded
So
organisations
it's a lesson to all of us, and
only
lesson to
2%
us as managers and
have the
leaders
highest level of evidence.
that we really need to be careful.
So we can
it's
see
not
how
just about
challenging that
gathering
is,
data,
gathering
and how we might
information, or
want to
gathering the
move that
stats,
forward, and
very,
have
very much
evidence
about making
based
sure that
a
that's
central
meaningful
piece
and that we
of
don't
all
lose
our
sight of the children and families that we're
And so
working with.
what does this all mean for us all, I suppose, and why are we doing this at all? Why are we
sort of just
focusing on
sets the
outcomes
scene
and
about
what some of what we
difference
hope
does
to
it make?
address?
We're all very, very busy
today.
delivering to children and families.
So, just to make sure we're all on the same page,
and I suppose the question is,
what do we mean by evidence-based?
And how do we know we're actually making a difference?
We could have a whole day about this, and we could have a really
busy
existential discussion
and doing,
but
that we
essentially
often never
the concepts came from medicine and health,
are we actually
and really
making a
very
difference?
much
And what do
about
we mean by that?
integrating,
Really,
the best
is
available
anyone
evidence,
better off?
but
Also
from
in clinical
our
work that we're
expertise
doing
and
in home visiting.
experience,
And it
and
really
the
is
values
worth
and
pausing and
preferences
taking
of
the time to think
clients,
about
as it
that.
would be in maybe health,
and it's probably not
but of
something we get the
parents
time
and
to
children and families.
do.
So
And
that's
that's where
evidence-based practice, and that's
the
been around for
torture of
quite
doing
some time.
actions like a
And
logic
there's a
model
wealth
really do
of,
afford the time to think through,
organisations
and hopefully
structures,
that's the space we've
all
created
dedicated
today to
think through
what
fine-tuning
and exploring evidence,
and is anyone better
to
off by our
support
work.
health services and so
And
on.
I suppose
in
why you as leaders and
delivering
managers
evidence-based practice
and coordinators,
evidence-based programs, and
really,
this is a
you guys
definition
are the essential.
sorry.
As I say, I sometimes say the pinch
I found
point
from
the real
that I just happen to
core
like.
of,
It's from
making a difference in terms
from
of
Washington
supporting
University
your team,
but evidence programs are
creating
programs
the right
that have been
culture
rigorously
for
tested
how
in
a
controlled
sort of an
settings
outcomes-focused
work
would
proven
would
effective
happen,
and translated
but also
into practical models
feeding
organisations
what we know
can
is
deliver.
important for children and
So
families.
it's much more
and
packaged,
protecting that,
much more kind of
as we move,
have boundaries.
as we look towards something like an outcomes
and
framework.
I
We're also
suppose,
there to
and I've
receive
just
and
the difference
to share
between
up and
evidence
down
informed,
that
obviously,
sort
is
of
that you
knowledge.
have the
So
evidence to
really,
inform your work,
those of us
which is more
on the call
akin
who
to
are
leaders
evidence-based
and
practice,
coordinators of
but
home
evidence-based
visiting
programs are those
really
programs that you'd be
essential,
very familiar with
to
in terms of
making sure that we
parenting
do this
programs,
well, that we do this right,
that we
sort
need to
of
listen
standard
both top up and bottom
6 or
down
14-week parenting
so that we
programs
can
that you might all
do
be
this in
familiar
the
with.
best interests of
But
children
in
and
home
families we
visiting,
work
all
with.
the current
So
programs
it's really
in
great that we have so
Ireland,
many of you on the
would be
call
classed
here
as
today.
evidence-based programs because they
But
would
we
have
also
all
need to
had
work with the
RCTs
leaders
at some level,
interagency
that
partners, our
demonstrate
TUSA
their
stakeholders,
evidence
our HSE
base.
stakeholders who are also leaders
and they also
and
have the
creating
other
the right
characteristics
culture,
that
both
are
internally in
in
our
our
organisations,
organisations,
but also within local areas,
and so on.
that we can
and
deliver
so
the
it's
right outcomes
just
for children and
helpful
families.
to understand those
And
different
I suppose,
concepts. I don't know if many of you are
and
familiar
I
with
suppose
The
on this
Wire.
slide we could talk again for hours
Obama's
about
famous
what do we mean
favourite
by levels
TV
of
drama
evidence or
series.
evidence. And you can go
It's
to
one
different
that's not
structures
possibly
like the
for the
Cochrane
faint-hearted in
Cochrane
terms of
Institute, or
you
can
could
definitely
got an over 18s rating.
evidence-based clearing houses to look
But
at
it's
how
so
you
much more
define
than just a
evidence
gangster drama.
levels. And
But
hence
at the
why it
very
was
top,
Barack
we have
Obama's
the very
favourite.
highest
It very
level of
much looks
evidence,
at
which are
systems,
systematic
and
analysis
I
or
suppose
meta-analysis.
I'm just
of
flagging it here. We are going to
randomised
talk
controlled
about
trials.
systems
And
as well.
I'm not going to spend too long on this,
session,
but you can see how
in
it
The
is a
Wire, you've got
hierarchy,
school systems,
and at the
police
bottom
systems
of it,
the
you would have
legal
more
system,
literature reviews.
and
or
what we
expert
find is, even
reports,
though they
or,
are gathering
evaluations
data and gathering
and so
stats,
this is something
children
that
and
has
families
guided
still fall through the net.
how
it's a
programs
lesson
are
to all of us, and
recognised
lesson
in
to
terms
us
of their
as managers
evidence,
and
what
leaders,
do we mean by
that we
evidence.
really
You
need
can
to
see
be
it's quite
careful.
a
It's
high
not just
benchmark
about
to achieve.
gathering data, gathering information, and gathering the
from a
stats,
home visiting
but
point
very,
of view,
very much
obviously,
about making sure that
TUSLA
that's
in their
meaningful
commissioning
and that
framework,
we don't lose
they
sight
refer to
of the children and
particular
families that
4
we're
levels of
working with,
evidence that were developed by
in that
Veerman
system.
and
So,
Purin. I'm not
so
sure I'm pronouncing that right.
sort of just sets the
But
scene
also in
about
Ireland we
some
have
of
the
what
What
we
Works
hope to
Evidence
address
Hub. And what's
today.
interesting about that is that they really look at
just to make sure
outcomes
we're all
only
on the
for
same
children.
page.
So in terms of a program,
What do we mean by
they would only look
evidence-based
at
evidence-based
a
practice?
program
And
has
we could have a whole day
demonstrable
about
outcomes
this.
for
We could
children
have a
only,
really
and again
existential
at the highest
discussion.
level of evidence.
But essentially,
and in
the
America,
concept
there is
came
a
from
structure
medicine
called
and
Home
health,
V, which also
and really very
evaluates
much
the
about
evidence-based
integrating
programs. But they do
the best
consider
available
outcomes
evidence
for parents,
but
or
also
wider
clinical
outcomes for families,
expertise
and so
and experience,
and
we're going to
send lots of resources at the end. So any of you who would like to delve into that little bit further or explore some of those,
children and
we can
families.
send
So that's evidence-based practice, and that's been around for quite some time
about all that.
And there's a wealth of
But in terms of
evidence-based programs,
obviously
structures,
there's
a few
dedicated
key elements to them,
fine-tuning
and exploring
of
evidence to support
the
health services
around my
and so
slide
on,
so I can see
in terms of kind
delivering
of
evidence-based
factors or
practice.
categories about
Evidence-based programs,
obviously,
and this is a definition.
They outline what works. So they all include like training.
I found
they would have a guide.
but I just happen to like it
to
them.
They also
from
distill
Washington
down
University.
how the program works.
But evidence programs are programs that have been rigorously tested
universal
in controlled
sessions, which we've all distilled
proven
down,
effective and translated
core
into
relationship
models that
with
organisations
parents and a home visitor.
So,
but it's
much
also
more packaged, much more
needs
kind of
to have fidelity.
Have boundaries.
And if you have to do what
I suppose
the program says in order to
the difference between evidence informed, obviously, is that you have the evidence to inform your work, which is more
and so they're
to
key factors of it. They also
evidence-based programs are those programs that you'll be very familiar with.
We frequently throw around the term evidence-based,
the sort of standards.
I suppose need to be really careful because at the moment what we mean is that it's an evidence-based,
but in home visiting,
outcome
for a particular
cohort
of children and families
would be classed as evidence-based.
And so, for example,
they might be looking for an evidence-based
programs
at some level
targets
that
demonstrate their evidence.
But the programs that are available might only target
and they also
early
have the
childhood
other
literacy
characteristics.
So it's really important to
in
actually
terms of
know
training
what the
and
evidence
structure
is for a
and so
particular
on.
program and whether that actually meets your needs or the
helpful to
families that you're working
understand
for.
those different
An
concepts.
example might be in Ireland. We have
I suppose
very
on this
little
slide we could talk
research
again
in terms
for
of what might
hours
work
about
for some
what do we mean by levels of evidence
for
or
our traveller
evidence.
community.
And you can go to different structures
one
like the
RCT
Cochrane
done
structure,
an
Cochrane
extension to the
Institute,
traveller
or
community. You can
way
look at
back
other
in the
evidence-based
clearinghouses
to look at how you define evidence.
But
there are very
at the very
few,
top we have the very highest
level of evidence, which are
systematic analysis
or
or
meta-analysis
will have on those
randomized controlled
I suppose
trials.
that there are
I'm not going to spend
challenges
too long on this,
to
but you
the
can see
concept
how
of
an
it.
evidence-based program
It is a
and
hierarchy.
That is that,
and at
at
the
the very
bottom
piece
of it
can
you would have more
can you take it
literature
from one
reviews
context
or
and deliver it in another
reports or,
context?
evaluations.
And obviously the
And
research
so
would say
this is something that has
replication
guided
and adaptation studies to see if it actually
how
works.
programs
If it
are
works in an urban
recognised
area,
in terms of
will
their
it also work
evidence
in a
and what
rural
do we
area?
mean by evidence?
And you can see
a
it's
really
quite
good
a high
example of
benchmark
this.
to achieve. And apologies
I've just
to those of you who've heard me reference it
from a
before,
home visiting
but it's
point
the
of view,
most famous
obviously,
home visiting
TUSLA
program,
in their
which is
conditioning
Nurse Family
framework.
Partnership
They
in
refer
America.
to
It's been around
4 levels
research
of evidence
started
that were developed
in the
by
1980s.
and
It's had
like Curran,
18 years of longitudinal studies,
but
and
also in Ireland we have the
what works.
But it was
delivered in the UK.
And what's interesting about that is that they really look at outcomes only for children.
In terms of
UK
a program cohort,
that they would only
surprisingly
look at
the
whether
first results
program
of
has
their
demonstrable outcomes for
were
children
not so
only.
positive.
And again,
and
at
it was
the
a bit of a
highest
wake-up
level of
call
evidence.
as to, well,
And
why
in America,
it's the
there's the
best
structure
evidence-based program that we know of. Why didn't
the
it work
evidence base of
in the
programs?
UK?
But they do
And so
consider
we really had to
outcomes for
understand
parents
the
or
context that
wider
it was being
outcomes for
delivered
families.
in terms of
And so I suppose
austerity, in terms of
referrals.
we were going to send
in
lots
terms
of
of
resources
how
at
it
the
all
end.
works.
So any of you who would like to delve
it's
into
really
that a little bit
important
further
to kind
or
of
explore
understand
some of these
those.
elements,
We can send
rather than
on
kind of being so
websites
casual
and so
about
on,
what an
about
evidence-based
all
program is. There are
But
other
in
major
terms
challenges
of
is that it
evidence-based
takes nearly
programs,
10 years
obviously,
before
there's
that
a
evidence
few
can
key
be
elements to
generated
them,
and actually used.
in terms
the cost
of
implications are really considerable.
Sorry,
We're
I just have to
talking,
move things around my
cost
slide so
up
I
to
can
€1 million
in terms
for
of kind
an
of
RCT.
factors or
And
categories
after
about
all
them.
of that, it might not actually
obviously
be what funders
they
want.
outline what works.
Funders
So they
might
all
want
include
a program,
training.
and I think
they would have
a good
guide,
example of
they
this
would have
is
a
that
structure to them.
they also distill down how the
program
program
works.
engage with some of the more rigid parenting programs that we're familiar with that are there, which we've all distilled down, which is obviously that core relationship.
And funders
with
might come back to us and say, well, actually,
and
we
a
need
home
something
visitor.
else that will
But
deliver
it
the
also
same key messages, but in a different
needs
way.
to have fidelity, and if you have to do
there's lots and lots to
the
think
program
about. It's
says
not so
in order
straightforward, and I think we need to be
the results
quite
or the
mindful
outcomes
when we're
that the
using the
program has
word
demonstrated.
evidence-based and what we
and
mean
so
by
there
that.
are key factors of it.
So
But also
lots of
they
food
also
for
outline
thought
who
there.
it works for. And so I suppose
and just going to frequently throw around the term evidence-based is really something more dynamic.
We, I suppose, need to be really careful because at the moment what we mean is that it's an evidence-based for a particular outcome
in the case of
for a particular
I'm most
cohort
familiar
of
with,
children and
Community
families.
Mothers Programme.
And so, for example, you might be looking for an evidence-based programme
that is much more dynamic and considers some of those challenges that we flagged there.
The programmes
that
that
is
are
really,
available
if we start
might
with the
only
practice
target
with families
early
here on the
childhood
slide,
literacy.
and apologies,
So it's really important to actually know what the evidence is for a
what we really
particular
need to
programme
start looking
and
at
whether
is a
that
range of
actually
different
meets your
outcomes,
needs or
including
the families that you're working for.
outcomes.
An example might be in
want?
Ireland.
What do they enjoy
We have
and
very
engage
little
with?
research
And how
in terms
well
of
can
what
we
might work
deliver
for some ethnic
that
minority
service to
groups or
families?
for our traveller
Then
community.
looking at maybe mediating
There was
outcomes.
one RCT
what are the
done,
things we
an
need
extension
to
the
make
traveller
to
community
achieve our outcomes? If we're
way,
not
way back
getting
in the
referrals in pregnancy,
early 90s,
we haven't got a hope of
the
impacting
Community
on the
Mothers
breastfeeding
programme.
outcome.
But there are very
engagement
very
outcomes.
few,
Who really turns
in
up
terms
and
of
engages in our sessions, but
who
more
it works
importantly,
for
maybe
and
who
what is
doesn't,
the impact it will
and
have on those
why
families.
I
suppose that there are challenges
with us,
to
why
the
aren't
concept
they
of an
staying
evidence-based
the course
programme,
or the duration of the
that is
intervention?
that very piece.
And do we
you
even
take it
know
from
that
one
sort of level
context
of
and deliver
information?
it in another context?
So questions there
and
for us.
obviously
and finally,
the
and the
research
most
would say
important
you
one
need
is
to do
anyone better
replication
off
and
from
adaptation
what we
studies to see if it
deliver.
actually works.
And obviously,
if it works in an urban area, will it also work in a rural area?
Program, we're talking about
and a really good example
years,
of this.
And we can
and
only
apologies
measure
to those of you who've heard me reference it before, but it's the most famous home visiting program, which is Nurse Family Partnership
3
in America.
or 5 years
It's
on.
been around.
So we really can't
started
look too much into the long term in terms of adolescence.
It's had
but we want to have some
years of
benchmarks
longitudinal
that
studies and it's the most referenced.
So setting our
but it was
long-term
delivered in the
ultimate
UK
outcomes
during
but then
austerity,
short-term,
and
very tangible ones are very important to look at.
To
what we're looking at
UK
then is obviously
cohort.
gathering all
and
this information.
Surprisingly, the first
kind of
results of their RCT were not so positive. And it was a bit of a wake-up call as to
analysing all that
it's
information,
the
looking at what other
evidence-based program that we know of. Why didn't it work
to the fore,
in the UK?
making sure
and so
we're doing
we really
all
had to
that in
understand
consultation
the
with
context that
families,
it was
so
being
we really
delivered in terms of
and hearing
austerity,
what
in
they
terms
want
of
and need,
referrals,
and feeding
in
that
terms
back
of
in
how
so
it
we
all
can
worked
learn
together.
from it,
So
and we can change.
it's really important
tweak our
to kind of
practice,
understand
tweak
some of
these
these
elements
elements
that we're offering
rather
families.
than kind of being
So
so
what we're really
casual
proposing
about what
is
an evidence-based
something
program
like
is.
this.
There are other major challenges is
whether
that
we can all
it takes
come on
nearly
board
10
with
years
something
before
like
that
this, but
evidence can be
it's a lot of work
generated
and actually
and
used.
a lot of the cost implications are really considerable.
So
we're talking, could cost up to
that
€1
brings
million
us to
for an
outcomes.
RCT. And after all of that,
please
it
do,
might not
as I
actually
say,
be what funders
rattling
want
on here because we got
funders might want a program, and I think a good example of this is that
but
if you have questions, do populate the chat, and we will come back.
can't engage with some of the.
So what do we mean by parenting programs that we're familiar with? That all joined us today, and many of you filled out the many niches, and we'll have a look at that
funders
now.
might come back
to make sure we're on the same page. I think this definition is probably the same key messages.
So outcomes are what we wish to achieve. They're socially meaningful changes.
So generally defined in terms of
it's not so straightforward, and I think
skills,
we need to be
attitudes,
quite mindful
behaviours,
when we're using the word
status.
evidence-based.
So
and
what we mean by that, people will have a job.
So lots of food for thought there.
Better in school,
or will. So what we're looking at and what we want to tease out today is really something more dynamic
or a skill,
something that's not maybe got its
definition is quite
fixed at a
helpful
point in time back in the 1980s in the case of the program I'm most familiar with, which is the Community Mothers Programme.
As I said, you all kindly
and
participated
that
in our
moves with the times and that is much more dynamic and considers some of those
if anyone
challenges
hasn't,
that
the code is there.
Please, and that is really, if we start with the practice
that
with
would be
families
great.
here on the slide,
we've got a really well informed audience today, which is fantastic. We asked you
what we really need to start looking at is a range of different outcomes,
and that's
including
great.
kind of
And this can be really
implementation
helpful for us
What do
as
families
we
actually
look
want?
at any
What do
other
they
possible
enjoy
training
and engage
pieces
with
as well.
And how
So
well can we
people are
deliver
really well informed in
that
terms of
service
outcome
to
frameworks.
families?
So we're
Then
already
looking at maybe mediating outcomes. What are the things we need to make to achieve our outcomes? If we're not getting referrals in pregnancy,
other pieces like
we haven't got a hope
the
of
standardized
impacting on the
measures and so on. I
breastfeeding
think that was really interesting for me to see.
Engagement
so we can
outcomes.
definitely
Who
look
really
at
turns up and
where to
engages in our
focus
sessions? But more
training
importantly,
needs as
maybe
well
who
going
doesn't?
forward.
And why?
But then we asked
are
you all,
those
because
families not
obviously an
engaging with
outcomes
us?
framework
Why
is
aren't they
essentially a
staying
system
the
for
course or the
reviewing
duration
if we're
of the
making a
intervention?
difference. And again,
and do we even know that
those
sort of
of you
level
who
of
replied
information?
said, The majority said
questions
we
there
do have a system,
finally, and the most
great.
important one is,
And I love
the
fact that
from what
we
others
deliver.
have said, and
obviously
we can, with let's be honest, we don't, because it's a very complex program. We're talking something like this up
early years,
but we're working on it,
and we can only measure those.
So we really
short-term
outcomes.
Want
after
to try and see how we can best support
many of the programs
this way of having a system
3
in place or 5
and
years
outcomes
long.
framework is
So we really can't look
one
too
way
much into the long term in terms of adolescence,
whether we're making a difference.
but we want to have some benchmarks there that we can aspire to. So setting our long-term ultimate outcomes,
more about your system,
short-term, very tangible ones are very important.
Shared your feedback. I won't go through all the comments, but this will be really helpful for us as part of the consultation.
And kind of
so people have talked about
formal evaluation frameworks based on logic models
through
and the
information
collect,
and then
other
analyzing all that information,
measures they
looking
use,
at what other
measure here is the
research
toxicity
evidence is coming.
Other
to
people
the
have
fore,
said
making sure
they
we're
have
doing
feedback
all
forms
in
at the
consultation
start,
at
at
the
the end.
end.
So we really are
and to
listening
their
and hearing
intervention,
what they want and need,
and
feeding
so
that back
I won't
in
go
so
through
we
all
can
of
learn
them,
from it.
but thank you very much for putting them in. We'll explore them, the programs that we're offering. Thank you.
So what we're really proposing is,
and we asked you to tell us one word,
asking
whether we can all come on
how
board
to
with
describe an
something
outcome
like
in
this.
one
But
word.
it's a lot of work,
and so we do have
a lot
change
of,
there. We do have
factors
difference,
to consider.
impact, effect,
So,
which is great. Result
that brings us to.
You can see how
outcomes.
it can be very easy for us to get.
And
please do, as I say,
to make sure we are
on
all
here
on
on
the same page
and how helpful this exercise is, because
in
some ways there's no right or wrong answer,
but it's
if
just
you have questions,
making sure we're all on the same page as it were.
So that's
what do we mean by
thank you all
outcomes?
again
And
for sharing.
you guys have all joined us today, and many of you filled out.
And then we asked again some jargon-busting
questions.
We asked you
to make sure we're on the
tick
same page. I think
all
this
the
question is probably quite helpful.
that you feel
So outcomes are what we wish to
true.
achieve.
And again,
They're
there's no
socially
real
meaningful
right or wrong
changes,
answers here. It's
generally
very
defined
much,
in terms
are we
of
on
a
the same
change in
page,
knowledge,
language,
skills,
attitudes, behaviours,
and so what the
conditions,
first
or
statement was,
status.
outputs are
So
important
an
measures
outcome
of
is
change,
that
and
people
I
will
think
have a
outputs
job,
are
or
really
will
the work we
achieve
do,
better in
all
school,
our doing, all our
or
activities,
will, have
and they are
positive
so
mental
important
health.
for us to
So
measure. And I think they're
or it could be
essential.
an attitude or a skill.
Implementation
And
outcomes.
I think that definition
But they don't
is quite
tell us
helpful
really if
as we,
anything has changed for families.
to have a think about,
so they are
and
really
to hold
important
as
for
we
us.
go on.
As I said,
But
as an
as I said, you
implementation
all
measure.
kindly
But in terms of
participated
change,
in our Mentimeter,
unless they don't tell us if actually something has changed.
If anyone
for
hasn't,
parents,
the code is
or
there.
children.
Please
Indicators definitely are
that would be
telling us
great
if we're on the right
but
track.
We've got a really well
in
informed
general,
audience
we're going to
today,
want to
which is
set
fantastic.
outcomes
We
that
asked
reflect change
which
for
of
the
the
better.
following you were familiar with.
If it's
that's
a
great.
homelessness
And this would be
outcome,
really
then we
helpful
want to
for us
reduce
as
it.
we
So we want to
look
have
at any other
outcomes that
possible
really do
training
reflect
pieces as well.
positive change.
So people
for
are
the
really
children
well
and
informed in
families
terms
that
of
we
outcome
work with.
frameworks.
And
So
I love the
already
fact that everyone said zero, that outcomes are only necessary for funders. So that's just, we're already on a winning streak there if people
and I think
really
there's
understand
other pieces
that,
like
we want
the
outcomes for
standardized
ourselves
measures
and
and so on.
not just
That was
for
really
funders.
interesting for me to see.
So
we can
excellent.
definitely look at
and the last one, I suppose, is a little bit of a trick one in terms of parent satisfaction forms or a parent
but
outcome
then we
measure.
asked
Parent
you all,
satisfaction
because
forms are
obviously
so
an outcomes
important
framework
because we
is
really need to
essentially a system
understand
for
and
reviewing
know,
if we're making a difference.
how well parents
and again,
enjoy or
those of you who
participation in our
replied
service,
said
how they
the majority
evaluate
said
it.
you do
it's
have a
essential
system, which is
outcome
great.
measure,
And
absolutely.
I love the fact
essential
that
implementation outcome
others
measure.
have said,
But
what,
unless
we
we
don't
ask a
have one.
question as to
let's be
whether
honest
something
about it, we
has
don't, because
changed
it's very
for
complex
parents,
to set something
then
like
it's
this
not
up.
necessarily going to tell us
But we're
if
working on it.
if it's a parent outcome
So we
measure.
really do.
So we need to really think
want
about
to try
how
and
we
see
use
how
our
we can best
outcome
support
parent
this way
satisfaction
of having a
forms and
system in
possibly
place,
include
an
a
outcomes
change
framework
question there, so we can
is
measure
one
and
way
track
in which
what
we can
has
look
changed,
at
whether
for
we're making a
parents,
difference to children and families.
And finally,
I think
I always like this
so
one
we
because
asked
it just
you,
helps us really focus
more
if we're on
about
the
your
same page.
system, and you all
And again, there really is no
shared
right
your
or wrong
feedback. I won't go
answers
through
to
all
any
the
of
comments,
these.
but this will
It's
be
just a
really
matter of
helpful for
language
us as part of the consultation.
We really want to
So
look
people
at
have talked about
change.
formal
What has changed
evaluation
for the
frameworks
parent
based on
or
logic
the
models
child that we're working
and
with.
the information collect.
And again,
other people have talked
the
about
first one they
measures they
supported me
use.
so much
One
is
familiar
so
measure here
important
is
as
the
an
implementation outcome.
Other people have said
the fact that it's,
and
they
it
have
could
feedback
forms at the
parent
start,
support
at the end,
can obviously
and
be
to
an outcome
rate
measure
their
for
intervention.
parents.
Obviously, if
and
it's
so on.
if they're
So I won't
relying
go through
on the
all of
service
them,
for that
but thank you
support,
very
then
much for
we'd
putting
want to
them in.
wonder, is that
We'll
the best
explore
outcome we
them
want to set
afterwards.
again, thank you.
But So anxiety reduced, and we asked you to tell us one word. And I understand my child's behaviour is how to describe an outcome in one word. An understanding, knowledge, and so we do have change there. We do have difference. Impact, I felt so welcome is so important. Which is great result for us to know if we're doing well. You can see how it can be very easy for us to get in terms of implementation outcomes and to make sure we are all on the same page and how helpful this exercise is, because it doesn't actually there's no right or wrong answer, but it's just in the lives making sure we're all on the same page as it was. Just helps us think through. That's really helpful. Thinking about thank you all again for sharing that. What we want to set and how we might decide. And then we asked again some jargon busting questions. We asked you to tick maybe. So I'm going to finish up talking soon. Sorry for going on for so long. Just reminding again, there's no real right or wrong answers here. It's very much before we on the same page with our breakout room. And so just the first statement was some of you may be familiar with this, so maybe aren't. I think but this is really the work we do, those national outcomes from our activities, and how we're measuring on them. And it's just to show that essential. You know, I think sometimes when you show implementation the level of detail, but they don't tell us makes it more tangible. It also brings the local, the national, because you can see it's really important for us. Do we have a role in breastfeeding measure? Do we have a role in immunisation of change, parental mental health? You know, these are indicators towards the outcome for active and healthy. And I think it's really interesting to delve into this and have a bird's eye view of how our children are doing. In general, so even if we look at breastfeeding outcomes that reflect change for the better on my screen, you can see that if it actually dipped, then we want to reduce it. And so we want to have outcomes that really do reflect COVID and the lack of change. I'm not sure, making assumptions there. But I love the fact that you can see how helpful it is to say, gosh, are only necessary for funders. So that's just, we're already on a winning streak there. If people and what really understand that we want outcomes for ourselves. They're not just in terms of the percentage of total live births classified as low birth. And the last one, I suppose, is a little bit of a trick one in terms of parent satisfaction forms are a parent outcome measure. That the number of satisfaction forms are so important because we really need to understand reducing, which is a positive, how well parents enjoy in terms of or participate in our service, and that's something they evaluate that really can make a difference. Essential that low birth weight is strongly linked an essential implementation outcome measure. But unless we ask a question as to whether something has changed with higher birth weight, then it's not necessarily going to tell us if better outcomes if it's a parent outcome measure. So we need to really think about an idea how we use this sort of way of working and looking can be so helpful and so important. And if we had questions there, so we can level of data for our own organisation, we can track and see how are we doing. And finally, as an organisation, I always like this one because it just helps us really focus on these outcomes or and again, there really is no right or wrong answers to any of these. It's just a matter of language. I'd share with you the outcomes we really want to look at change, because what has changed for the parent. Home visiting is still so new as a service delivery or as a programmatic delivery, me so much. It's so important internationally at a national level. The fact that there haven't been sort of benchmark parent support. The United States is the first to have federal fundings. Obviously, if approved for home visiting services, the service for that support. So these are the 8 best outcomes we want to set. The US have set, and I suppose. But I share them for lots of reasons. One, just to see what's happening around the world. But also, what I like about them is they're not just for children. They are also for parents, for maternal health, which is great. Positive parenting. I felt so welcome. But also systemic outcomes like linkages and referrals. If we're doing important home visiting for navigating the systems that I spoke about earlier, delivering our service well. So I think that's something we want to bear in mind when we look at what sort of outcomes we want to set for just helps us think through when we're thinking about outcomes, what we want to set and how we might decide. Before our breakout room, and I think I'm on track time-wise. These are questions I'm going to finish up talking soon. Sorry for going on for so long. Just reminding everybody of our national outcomes and I think that it's a really helpful tool. It's not perfect by any stretch of the imagination, but it does link the local to the national. Some of you may be familiar with this, or maybe aren't. That that might feed up to that national, of those national outcomes from different systems, or PHN, and how we're measuring on them, working alongside just to show that our maternity services. I think sometimes when you show colleagues how we can achieve outcomes together, it makes it more tangible. The bluntness of the questions, I suppose, because it helps us focus as an organisation. Do we have a role in breastfeeding? The different types of outcomes. So how much did we do are very much the outputs. These are indicators towards the outcome. It referred to the bums on seats. And I think it's how many people turn up. Interesting to delve into this and have a bird's eye view of how our children are doing. How well we did it is really important, for us to look at my screen. You can see that it actually but ultimately at the end is anyone better off. And so just to focus again, our minds have said this a few times, but we're really looking at changes, making assumptions there. But skills, knowledge, you can see how helpful it is to say, gosh, what's happening with our breastfeeding rates, skills and knowledge and parenting and child development we have to in that. Opinions, the one on that we believe attending school is important, behaviours that low birth weight is turn up for appointments, participation in school, showing that have positive health behaviours. That's a number of circumstances have actually changed. Something very concrete has changed in the lives of children and families. So there are sort of scene setting, and that's something because that's where you really can make a difference. And we're going to low birth weight. I'm going to stop talking and invite you all. Michelle is going to organise us into breakout rooms with higher birth weight, having a direct correlation to better outcomes. So we get this just gives you an idea of why this sort of way of working and looking can be so helpful and so important. And if we had this sort of level of data for our own organisation, we could track and see how are we doing as an organisation and what role we can have either on some of these outcomes or other
sorry about that. No, you weren't. You just muted that time. It was me. I was just trying to mute everyone.
Just thought I'd share with you the outcomes of the United States populate because not any home visiting is still so new as a service delivery or as a programmatic delivery, and across internationally at a national level, there haven't been a sort of benchmark set. The United States is the first to have federal funding room one approved for home visiting services and recognising it. So these are the 8
I'm not sure what room number
the US have set, and I suppose I share them for lots of reasons. One, just to see what's happening around the world, but also what I like about them is they're not just for children.
Identified yourselves and made yourselves
for
visible.
Parents, for maternal health, like to share positive parenting practice, but also systemic outcomes like linkages and referrals, and how important home visiting is for navigating the systems that I spoke about earlier.
We also said,
so I think that's something we want to bear in mind when we look at what sort of outcomes we want to set for home visiting in Ireland. And
the progress, so the child
finally, before our breakout room, and I think I'm on track time-wise, these are questions that I've borrowed from an approach, a tool called outcomes-based accountability. And I think that it's a really helpful tool. It's not perfect by any stretch of the imagination, but it does link the local to the national and how we locally work on outcomes that might feed up to that national. If we're all working together within our different systems, our PHN and our home visitor, working alongside our maternity services and our TUSLA colleagues, how we can achieve outcomes together. But I like the bluntness of the questions, I suppose, because it helps us focus our minds.
Any other feedback on that, or will we?
And the different types of outcomes. So how much did we do are very much the outputs, or as you might have heard, it referred to the bums on seats. How many people turn up? How long do we offer the service for? How well we did it is really important, for us to look at, and there are implementation outcomes. But ultimately, at the end, is anyone better off? And so, just to focus again, our minds, I've said this a few times, but we're really looking at changes, improvements, reductions in either skills, knowledge, attitudes, opinions, behaviour, or circumstances.
Great. So they're really
from implementation, knowledge and parenting and child development to opinions like that we believe attending school is important.
That's room 6, so you're off the hook.
People actually turn up for appointments, participate in school, have positive
another
health
room,
behaviours,
maybe, so
or
room
circumstances
one,
have actually changed. Something very concrete has changed in the lives of children and families. So there are you volunteering, Margaret, to feedback? Prompts for you all. You just and we're going to, you'll be delighted, I'm going to stop talking and invite you all. Michelle is going to organise us into breakout rooms.
The break room ended, I think, a little bit like,
and
we didn't get to all of the questions either, but I suppose in terms of
feedback
the...
to hear.
Margaret, I also don't want to talk over you, actually. I see your mute come off there. Maybe you could join in if there's anything I'm misrepresenting.
Yeah, you were coordinating, I'll pop in if... Yeah.
Good on you. I suppose the first thing we talked about, increased parental well-being, has been an important outcome.
I've been chatting away to myself.
Sorry about that. No, you weren't. You just muted that time with me. I was just trying to mute everyone.
And then we have also
do populate the chat with any additional
child development.
Comments. So maybe we'll be, without further ado, we'll go to spokesperson for room 1. And just as Michelle says, if you model to think if we mute yourself those in already, I think we have. And Sinead or Margaret, did you have a chance to talk about how you might measure those? Who'd like to share some feedback?
I think what we were talking, or some of the suggestions, I'm very new to.
Yeah, I'm not sure what room number I was in.
I'm just getting going on it, but they talked about some different scales, or Margaret, I think you seem to know a little bit more there.
We'll go to room 6 then, because you've identified yourselves and made yourselves visible.
Well aware with like parental stress indicators,
to share from room 6.
Parental stress skills, parent-child relationship skills. Beyond those things, I think someone else in our group was familiar more with the more
positive parent
skills, you know, so that we could use some of those skills to measure.
We also
and TOPSY was mentioned as well.
So we
hadn't come up with exactly matching each scale to each area, but those were generally when we were thinking of those 3 outcomes.
The progress,
the skills
so
that we
the
were
child's
thinking might be relevant.
outcomes.
That's great. That's great feedback. Great. Thanks so much. Anything else before we move on? Can I ask, did you have any
I don't think we got further than that
how you
in
might
terms of
measure
specific
those
indicators each under the outcomes.
So we were saying regular
very great feedback, very efficient altogether, the 2 rooms so far. So that's room 1, room 2. Anyone from room 2 like to
home visiting would
give
you the outcomes.
The first one was increased parenting confidence.
The indicators of how well
my group felt that this was a really important one. The TOPSY was mentioned there as a measure of this. So really just kind of looking at
anyone else,
capacity building as well for parents, and
we also said that the pre and post home learning environment.
The second one was children achieving developmental milestones. So I just kind of stole this one from what we're doing in ELI, but through the CBTs, so the child behaviour traits assessments throughout the programme, and that would be
good feedback from
the percentage of children meeting their developmental milestones.
That would show
and then
you
the third one we chose was
the
improved engagement with the programme itself,
and the retention
we didn't
rate,
really get a
so
chance
the
to talk
amount
about
of kids
what
that
specific
stay and
measures we'd
families
use
that stay
here,
on the
but
programme.
So they're really
retention rates,
implementation
maybe something like that.
how well you're doing.
Those were our 3.
That's great.
Okay,
that's great. Well done.
Okay,
so that's room 6. So you're off the hook.
Anyone? Room 3.
Thanks, Michelle.
We actually
another room.
Maybe
so room 1. We're still trying to figure out who room 1 are.
A lot very
great,
similar to what
Margaret.
the others have said. I think it's because of the type of work
Is someone like to?
Are
you volunteering, Margaret, to feedback?
One of them was
to
measure the outcomes of the quality of the home environment.
I think I was in that room as well.
And that would be looking at it from an economic and a socio-economic kind of standpoint.
I think a little bit like,
you know, and we didn't get to all of the questions either,
but I suppose in terms
you know,
of
is there an addiction reason why the child
Margaret, I also don't want to talk over you, actually. I
rather than
see
it being
you
that the
come off
child
there.
needs support.
Maybe you could join in if there's anything I'm misrepresenting.
You were coordinating, I'll pop in.
Good on you. I suppose the first thing we talked about, increased parental well-being.
Again, that would be like a pre, during and a post. Sorry, the first one was a pre, during and a post evaluation.
When the lady that spoke before me strengthened parent-child relationship.
Parental involvement in community activities and family involvement in community activities. How linked in are they? How have they got the capacity to access these supports and groups and different
that's great. I'm thinking
kind of
back
things
to our
going on
logic
in the
model to think if we have some of
included
those in
or
already. I think we have. And Sinead or Margaret, did you have a chance to talk about, especially, you know, how you've got so many diverse communities, you know, in terms of integration as well as support from
some of the suggestions, and I'm very new to
all great.
the home visiting.
It was a great group, lots of
just
info.
getting going on
Great
it. But
stuff.
they talked
Great
about some
stuff. Did you
different
get around
scales,
any
or
thought about
Margaret,
measuring
maybe I
those?
think
You
you seem to know a little bit
mentioned.
more there.
Did you
We're
mention?
kind of saying like doing a pre.
Yeah, well, I think it's some of those,
evaluation,
Susan,
and
that you'd be
then
obviously well aware with,
evaluation
like
and
parental stress
post-evaluation, and
indicators,
some of it could be
or
observational.
parental stress skills,
Yeah,
parent-child
so there we
relationship
go.
skills.
Yeah,
Beyond
and
those
next
things,
session
I
we'll
think
talk a
someone
little
else in
bit
our group
more
was
about
familiar more with
how
the
we
more
might measure this
scales,
and some of
so
the
that
challenges
we
we
could
have
use
for
some of
this
those
age
skills
range.
to measure.
Yeah, and in terms of
and topsy was mentioned
observations,
as well.
you know, and
So we
some of the
hadn't come
challenges
up
there,
with,
and
exactly
video and
matching each
observations and
scale
so
to
on. But
each
yeah, data
area.
collection
But
is
those were
definitely going to
generally
be
when we were thinking of
a
those
key
three
topic the next time
outcomes,
around
the
how we
scales that
measure
we
them.
were
Great, thanks a
thinking
million.
might be
Room
relevant.
3.
That's great. That's great feedback.
Or is that room
Great.
2? Losing track.
Thanks so much. Anything else before we move on?
Was that room 3?
I don't think we got further than
so
that
room
in terms
4
of specific
then.
indicators each under the outcomes.
So we had really
very
similar
great feedback,
kind of
very
outcomes
efficient.
to
Put together
overview.
the 2 rooms so far.
Yeah.
So that's room
Good
1,
job.
room 2.
One of them really, I don't know whether
Anyone from room 2 like
to
to
reduce isolation.
great.
The first
that we
one
spoke
was
about as
increased
well.
parenting confidence.
I suppose in relation to
this,
iPass
Margaret
centres,
felt that this
speaking
is
a
a
bit
really
about
important
that,
one.
and
The topsy
integrating
was
them
mentioned
into
there
community, which can be
as a
quite
measure
tricky
of this.
in
So
certain
really
areas,
just kind of
especially
looking
because
at
I'm speaking from Dublin, but
kind
if
of
we
capacity building as well for the
nationally, I'd
parents,
imagine
and
it's the same type of
giving them the tools. But yeah, I think the
going
topsy was
on
the
and how we
the
can do
measure
that.
chosen there.
And again, we spoke about
The
how
second
comes
one
improving
was children
confidence within
achieving
the parent
developmental
and the parent's role.
milestones. So I just kind of stole this
with
one
their
from what we're
children
doing in
and how,
ELI,
we
but
can improve that
through the
confidence
CBTs, so the
with
child
them,
behaviour traits
to have
assessments
an improved
throughout the
relationship, I
programme,
suppose, with
and
their
that would
children
be
and their family.
the percentage of
all
children
that.
meeting their
So children are
developmental
more likely to
milestones.
reach developmental
And then
milestones.
the third one
maybe
we
if they have that
chose was
connection,
improved
you know,
engagement with the programme itself.
with their parents. And I
We
suppose an
didn't really
outcome,
get a
again, we
chance to
did
talk
speak
about
about CBT
what
impacts as
specific
well, I
measures
suppose,
we'd
coming
use
from
here,
ELI
but
and PC
someone
Plus.
previously said
We also
retention
spoke about
rates, so
topsy
maybe
as
something
well,
like that. Yeah, those are our 3.
as an indicator
Okay,
to
that's
measure
great.
that.
Well done.
For
Room
children,
2.
ages and stages as
room
well.
3.
We spoke about that with
Anyone
I think
relation
we're
to
room
public
3.
health
Sue
nurses,
said I'm
and
room 3.
with community families,
Yeah, we
we're
actually got
starting
so deep into the
with indicators
conversation
in
that we
top
didn't
baby
really get
forms,
to answer
that's
everything
very
in
its
full.
infancy, I
A
think,
lot very
community
similar to
families
what the other
with
girls
early
have
learning
said.
initiative.
I think it's because of the type of work we do. We're going to have
also
that
spoke about
similarity.
engagement
Yeah,
and attendance
absolutely.
as an indicator
One of them
for
was to measure the
an
outcomes
older
of the quality of the
demographic
home
of
environment.
children.
And that would be
And
looking at it from
yeah,
an economic and a
well, I don't know if anybody else wants it
socio-economic
from group
kind of
4.
standpoint.
It's great,
So,
Louise.
you know,
Really
is
comprehensive.
there a financial reason,
Great
or
feedback. And as
you
you
know, is
said,
there an
we're
addiction
getting
reason
a
why the
lot
child
very
isn't
similar
excelling?
things.
Very
you know,
similar.
rather than it being that the
Parenting
child needs
same
confidence,
support.
for sure.
Another
learning
one we had
environment,
was
and lots of
improved knowledge
great
and
stuff from
awareness
room
of
4.
parenting
So room
skills.
5.
And again, that would be like a pre, during, and a post. Sorry, the
Great,
first one
Maura.
was a pre, during, and a post
didn't write anything
evaluation.
down, and then we panicked when you
Another
said to
one
come out of
was
the room. Bear with me, and if anyone
parental
from group
involvement
5
in
wants to
community
add in, go
activities and
ahead.
family involvement in
So
community
we
activities.
looked
How
first
linked
at
in are
parental
they?
efficacy,
How have they
an
got the capacity
increased
to access these
recognition and awareness of the
supports
importance of the
and
home as
groups
the first
and
educator,
different kind of
with
things going on in the
consultation with the
community? Do you
parent,
feel included,
increased
or are they still
positive
isolated
parent-child
from that?
relationships,
Yeah, that's a great
attachment
one
and
at the end
bonding,
there, especially,
and
you know,
school
when we've got so
readiness.
many diverse communities, you know, and in terms of
Indicators that we
integration as
discussed
well
for
as
that
support
would
from
be,
community.
for an
That's
example,
all
if
great.
it
It was a great group, lots of input.
TUSLA,
Great
TUSLA,
stuff,
then
great
maybe
stuff.
6
Did you get
8
around
weeks later
any
post
thought
the
about
case, that would be an
measuring those? You
indicator that that had
mentioned,
gone well.
did you
We're
mention?
kind of saying like doing a
If the school had been in
pre-evaluation
touch with the
and
service
then
to say
an
that
evaluation and a
the child was
post-evaluation,
missing
and some of
days
it
or
could be
coming in
observational.
late or coming in with
So there we go. That next session we'll talk a little bit
clothing for
more
the weather,
about
and that had
how we might
improved. The school
measure
would then let
this
us
and
know.
some of the challenges
Or
we have for this
feedbacks
age
from our public
range.
health nurses who we work
And
in
in terms of
consultation with.
observations, you know,
And
and
to
some of the
measure the
challenges there,
outcomes,
and
there was many
video and
different. There was
observations and so
TOPSY,
on. But
there was
data
feedback and
collection is
closure
definitely going to
forms,
be a key
there was
topic the next
observational
time
developmental
around, how we measure
checklists
them. Great,
from
thanks a
one or
million.
two
Room
services that would
3,
be every 6 months, and that would be
or is
done
that room
again
2?
with the
I'm
parent.
losing track.
Great.
So was
That
that room 3?
probably lots more,
Sorry.
and we
it was.
talked about
So room
many
4
outcomes that we
then.
would have.
Yeah. And that's kind of one of the challenges is, not overcomplicating life for ourselves and keeping it focused as well. And I think, Maura, you raised something there, like we've talked about systems before, and I know Louise is going to pick up on that a little bit in a minute. But you mentioned a couple of things that are outcomes that might be achieved outside our organisation, like school attendance or attending developmental appointments or feedback from TUSLA, and they're very concrete, real changes that are happening. And that's one of our challenges, is how we can possibly measure things like that are not of our organisation. And that's why, as a system, if we can work together systemically, we might be able to track some of those really concrete changes in the lives of children and families, which would be great. So well done, everybody. So that was room 5. I think room 6, did we have already feedback from room 6? Yeah, so 7, we're flying it here. We're nearly keeping on time, Michelle. Room 7, feedback, please.
We also spoke about Susan, as well.
We were in room 7, so
we an indicator
had the same conversations as everybody else
ages
had.
and stages as well. We spoke
around
about
parental
that,
efficacy,
public health nurses,
also engagement with
with
TUSLA,
community families,
and we also spoke around
baby forms. That's very
probably off to the side, but around that engagement piece with family and around the frequency of home visits that we provide, maybe having a tool that would help us to decide around that. So kind of a framework around, do we increase the service or, that. So that's probably off to the side. It's not exactly an outcome as such.
And as you said, we're getting a lot maybe very similar things outcome as to how much are we confident, how well are we doing it, kind of learning environment.
And what's guiding our decision making
from room 4.
around
so room
our decision
5?
to increase the frequency of visits for this family. So
I think I've been
having a
nominated
framework, I suppose, a bit more around
Great,
that.
Maura.
We didn't write anything down, and then we panicked when you said to come out of the room. Bear with me, and if anyone from group 5 wants to add in, go ahead.
I mean, it's such a great opportunity to chat with fellow home visitors around all of these things. I'm really impressed that you managed to stay focused on outcomes, which is great. But well done, thanks to room 7 and our final room, room 8.
Positive parent-child relationships, attachment and bonding,
covered a lot of the
and
same
school readiness.
outcomes that everybody else has been talking about. So
indicators that we
outcome we were
discussed for
looking at
that
was
would be,
increased
for an
parent-child
example,
interactions,
if the parents
specifically
came in
positive
through
parent-child
TUSLA,
interactions,
and TUSLA had
and
then
using
maybe
the CBT and PACT assessment tools for
that would be an
measuring
indicator
that.
that had
And
gone
then
well
some of the
for
indicators
us.
we were looking at
If the
was
school had been in touch
the
with the
more
service to
observational
say that
in terms of the
child
child's
was
interaction with the
missing days or
parent,
coming in
language
late or
development,
coming in
and
with,
then recording the amount of interactions that
inappropriate
happen. So
clothing
again,
for the weather,
the
and
consistency
that
of
had
the
improved. The
interactions
school would then let
was
us
quite
know.
important, and
Or
level of
feedbacks
engagement.
from our public health nurses who
And
we
the
were in
second outcome we were
consultation
looking
with.
for was
And
it was
to
touched on
measure the
already, it was
outcomes,
reduced
and there's many
isolation
different. There
became
was
increased
TOPSY,
connections.
there was feedback and closure
So we were looking at
forms,
measuring
there
attendance,
was
but also the
observational
amount of
developmental
measuring
checklists
the
from 1 or
links
2
between
services
services
that
and
would
the
be every 6
amount of
months, and that would be
referrals
done
into
again
services,
with the
but
parent.
attendance rates and community-based programs as well. So outside of our own
lots more, and
program,
we talked about the
trying
many
to
outcomes
measure,
that we would have.
like you were saying earlier about education,
And that's kind of one of the challenges is,
outcomes as well.
not overcomplicating life for ourselves and keeping it focused as well. And I think, Maura, you raised something there, and like we've talked about systems before, and I know Louise is going to pick up on that a little bit in a minute. But you mentioned a couple of things that are outcomes that might be achieved outside our organisation, like school attendance or attending developmental appointments or feedback from TUSLA, and they're very concrete, real changes that are happening. And that's one of our challenges, is how we can possibly measure things like that are not of our organisation. And that's why, as a system, if we can work together systemically, we might be able to track some of those really address that particular focus in the lives of bear in mind some programs are more tailor-made to having everybody. So that was room 5. School readiness or literacy outcomes or home learning outcomes. We're flying it here. More health outcomes. We're nearly keeping on time, Michelle. What we want to try and propose, obviously, is something where we don't feel that every home visiting program has to tick all those outcomes. That you can find ones that work or align line for your program. Well, that's what we hope we will explore. But I think you're flagging that point there quite well, Gavin, and room 8 in terms of that. So that's really great. Well, listen, thank you everyone for your feedback. We're a minute over, which is amazing, and you're all very efficient. So I'm delighted we're recording this, so we have it all down, and we'll just look through all that at the end. Okay, so we're going to go back to presentation again, and then we will have questions and answers. I've allowed a good 15 minutes, so I'm going to ask my colleague Louise from Preparing for Life, maybe an implementation type outcomes, take the podium, as it were. I can manage the slides for you, Louise, so just tell me to move on, and then I'm going to talk a little bit more before we go to having a framework. So thank you all for staying with us.
If anyone else from my group wants to add anything that I have omitted, feel free.
Yeah, and here we are, Louise. I mean, it's such a great opportunity to chat with fellow home visitors around all of these things. I'm really impressed that you managed to stay focused on outcomes, which is great. But well done, thanks to room 7 and our final room, room 8.
Process of bringing outcomes into practice. It's not just done with researchers, it's done with home visitors on the ground, and it's so important how we integrate it into practice. And I suppose you'll see the word meaningful there in the heading of this slide. And this is something that we've really been trying to work on, is how to make this process meaningful, that it's not just about these outcomes that are disconnected from our practice, that it's really trying to integrate them into what we do. And I think that's a learning journey that we're on at the moment, that we're trying to do. So I'm just here to talk to you a little bit about that. So I suppose you'll see in the picture there, there's kind of oftentimes when we decide to do logic models and theories of change, we're kind of, there's something happening in our community or in our area, and we want to change something to a different place. So we have an idea of where we want to go, whether that's some of the areas that we talked about earlier, that we notice that there's potentially a lack of social connection, or we notice that maybe children could be maybe achieving more different milestones, or maybe mothers, there could be more mental well-being or well-being supports for them. And I suppose we can oftentimes set these particular outcomes, and I suppose when we think about that kind of maybe tells us about where we are and where we actually get to, but sometimes what we miss then is the bit in between, and oftentimes what actually happens is there's a journey of trying to get from here to there, and that's often then the practice of home visiting. So while the outcomes can be really helpful, something that we're also trying to look at is it might miss stuff around where is that happening, why is it happening, how is it happening, who is it happening for. It's those kind of practice pieces, because you'll kind of see on the right hand side there's a picture of that kind of messy piece. So while we might think it goes in a straight line, oftentimes there's a huge kind of messiness.
Thanks so much. And I think you mentioned there, you know, not all programs might address that particular focus, and it's something to bear in mind. Some programs are more tailor-made to having
direction, or what if something isn't working, or what if our
school readiness or literacy outcomes or home learning outcomes, and some more health outcomes. And I think what we want to try and propose obviously is something where we don't feel that every home visiting program has to tick all those outcomes, that you can find ones that work or align for your program.
I suppose as
well, that's what we hope we will explore. But I think you're flagging that point there quite well, Gavin, and room 8 in terms of that.
We have to make decisions,
so that's really great. Well, listen, thank you everyone for your feedback. We're a minute over, which is amazing, and you're all very efficient. So I'm delighted we're recording this, so we have it all down, and we'll just look through all that at the end. Okay, so we're going to go back to presentation again, and then we will have questions and answers. We've allowed a good 15 minutes, so I'm going to ask my colleague Louise from Preparing for Life. She's going to take the podium, as it were. I can manage the slides for you, Louise, so just tell me to move along, and then I'm going to talk a little bit more before we
was what were parents' expectations around sleep, because that was something that we were concerned about,
thank you all for staying with us.
Space then for us to
am I sharing?
Not just, I suppose, have outcomes, but also have questionnaires and questions that actually supported us to reflect on our practice or to open up conversations. So I think that's been a really I'm just going to talk a little bit around our journey that we're still on. Susan, if you don't mind for life, and I suppose something that we're really mindful of is that I suppose something else that we often talk about bringing outcomes into practice. It's not just done with researchers; it's done with home visitors on the ground. Oftentimes, when we think about research, we often think about this big O research. So we think about, I suppose you'll see the word science, and we think about in the university slide, and this is in and this broad generalizable knowledge and looking at is how to make this process meaningful. That it's not just about these outcomes that are disconnected from our practice. It's really important to be trying to integrate them into what we do. Feel this little and I think that's a learning journey that we're on at the moment that we're trying to do. So I'm just here to talk as a home visitor that practical. So I suppose you'll see in the picture there, you know, that I've often been able to reflect, looking at how do logic models or theories the change, because like in the previous slide, it can often be in our community or in our area. It's not as simple as we decide on something, you know, we want to go from here to there, and this is where we want to go. There can be a really messy space some of the areas that we talked about earlier that we notice that there's potentially a lack of social connection, or we notice that spaces and learn together about what it looks like milestones within those kind of mothers. There could be more mental well-being or well-being supports for them. If you could and I suppose we can oftentimes set these particular outcomes. It was just to bring in here as well, when we think about research, we that kind of maybe tells us about where we are and where we actually get to, we're actually trying to measure things then is the bit in between, really important. And also what actually happens is there's a journey of trying to get from here to there, and that's happening around us, and how do we move up and down that ladder. So while the outcomes can be really helpful, how do we move down to something that we're also trying to look at is it might miss stuff around so that we can where is it happening, why because I suppose it's how is it happening, who is it happening to awareness, like those great to know pieces whether something worked or not. Kind of see on the right hand side there's a picture of that has existed in. So while we might think it goes in a straight line, is it working oftentimes families, is it not working with other families, of what is there particular times when it's working, when it's not. So we might have indicators of how we make our getting there, but I suppose where it's also important can be really important as well, and that we're learning what if we need to change direction, or what if something isn't working, or what if our communities are shifting. Like so this was just a picture earlier I suppose share with systems. They're not often static. What we might see is in communities or with families, and we might think things are changing, the children learn, things change, or did they not learn? How do we what you might miss is continuously learning and being connected to the practice, and there may be context in those areas as well. There may be particular things that happen in practice as well. Just to so while it's great to have an outcome in terms of evidence, I suppose there's a really important piece around how we bring in that continuous reflection, how we think about adaptation, how we think about that messy decisions in between. That's where evaluation we are in our practice, and is to make those learning and looking at and to judge whether things are working or whether they're not. It was just to bring in that kind of conversation as well about how do we make the practice and how we actually make it learning together for people on the ground. And I suppose Susan mentioned, so I just wanted to give like one example around preparing for life, some of the stuff we looked at, and before it really important. We had decided actually what it really important maybe to look at stuff while it's great to sleep for children outcomes, and actually really important for families. Our home visitor was it wasn't just about, and it's not as straightforward as we moved something that they felt would sometimes it can be, but not for everybody. What were parents' how do we really go into that space where we learn that was something that we were concerned about as well, that it opened up the space then for the outcomes, not just as those have outcomes, but also have questionnaires and questions that actually support. So that's something that we're going to talk more about in the next conversation. These kind of cultures of learning, but it was just to kind of open up that conversation today as to how do we hold outcomes. Susan, if you don't mind going on to the next absolutely as at that higher level and that systematic level, but how do we also something else that we often talk about level and how it integrates into our practice for life we're doing today, and how we learn together this before is oftentimes when we think about research, we often think about this big research, so we think about as well like science, and we think about you know universities and people coming in and this broad generalizable knowledge.
That's great, Louise. Thanks so much. And I think you'll probably see that we're trying to really support, and especially by engaging with yourselves as our leaders in home visiting, and having our colleagues from TUSA and the HSE here, how we really want to create those cultures of learning, and that outcomes are really helpful in that regard. And I think those slides Louise shared with us there can really try and demonstrate that.
It's not as simple as we decide.
And I suppose just as we're finishing up before we do questions and answers, I suppose just to bring some of it all together, these are questions that are posed by some outcomes-based accountability that kind kind
learn
of
together
sum up that sort of
what it looks
ongoing
like,
learning
within
cycle.
those kind
And,
of,
you know, one
practice spaces
thing,
and that
you
as
know,
well.
as we're
So,
setting outcomes,
Susan, if you could move on
and I
to the
would
next
challenge
slide.
you maybe all when you come off the
So
call
it was
and you
just
think
to
about
bring
it
in
with
here
your
as well
team.
that oftentimes
And
in
it's actually
research,
can
we
be a
often
really hard
focus
question
on
to
that
ask is what
underneath
is
bit,
the
that
problem we're actually
systematic,
trying to
where we're
solve
actually
here?
trying to measure things.
And nobody
And
likes to
that's,
frame things
again,
in the
really
negative
important,
about
but so is
problems.
that systemic piece. Like,
But
how
we
do
are
we
funded to
systemically
deliver a
look at
service for a
what's happening
particular
around us,
reason, and
how do
often
we
we're
move
so
up and
busy
down that
doing
ladder in the picture? So how do we move
and so
down
on
to
that
the
it can actually
systematic,
be
but
hard
also how do
sometimes
we
to
move
actually
back
sit
up
down
to
and
that
think, what are we
systemic piece so
trying
that we
to
can hold
actually
both?
achieve?
Because I suppose it's
And
when we
that's what
have
really
both that we
helps us
can really act with
inform
awareness.
our
Like, it's great
outcomes.
to know whether something
And so
worked
it's
or
useful
not,
to then to
but
think about,
actually
well,
there's
then
a
obviously we're
context
on a
that
journey here,
has
and the next
existed in,
session we're going
and
to
how
move
do we really
forwards and look
sense
at
into that? Like,
really
is it
how we
working
can
with
start
some
measuring
families? Is
that,
it not working with other families?
how do
Is
we
there
know
particular
within our
times when
service
it's
if
working,
people
when
are
it's
better
not?
off?
So
Now,
I
people
suppose
will tell
how we
us,
actually make
but,
our outcome
you know,
data meaningful
is that
in
a
practice
real change
can be
for the
really
person, or
important as
people
well,
will
and that we're
reflect,
learning at
how
these
can we
different
actually
levels.
show that
So
change
Susan, if you
and
could just go on to the last
collect some
slide.
information on it
So this
that
was
is
just a
actually
picture that we
robust and
wanted
that
to
will be
share,
helpful.
because I
But that
suppose what
also
you might see is if we just look
we can
at a
gather
particular
and look
outcome,
at,
we might
as
think,
you
okay,
saw
did the
when we looked
children
at the
learn
national
or did they not
indicators, which
learn?
are
But
really
what you
helpful
might
to
miss
see
is that
how are we
context, and we
actually
can
doing.
see in the picture
So how
there,
can we track these
there may
things,
be
but also
context of
essentially who are
poverty,
the
there may be
people and the
particular things that
partners
happen in
who we
practice.
need to work
So while
with
it's
about
great to
this,
have
not
an
only
outcome
in
in terms of
terms of
yes or no, there's a really important
establishing what our
piece
outcomes
around how we
are, but
bring
also in
continuous
delivering them. And we
reflection,
would
how we
include
think
our
about
our
adaptation,
families
how
and
we
our
think about
children
that messy space in
in
between,
terms of that.
where
How
we
can
are
we
in our
set our
practice
outcomes
and in cycles of learning,
all
and
our
looking at
partners
actually what's
and kind of
happening
work
on the ground.
collaboratively with
So
them?
it was just to bring in that
we've
kind of
been
conversation as
mentioning,
well about
you know,
how
we
do we
can't be
make
solely
this that
responsible
it's
for
actually that
achieving
we're
certain
learning
outcomes,
together.
and you know,
And I
we
suppose
are part
Susan
of a bigger
mentioned in one of the
system.
Mentimeters around
So
human
these
systems
are all
learning, and this can be
questions
really
then that,
important
as
too,
Louise
because what it
mentioned
acknowledges
there, that we
is
want to
that
create that
while it's
learning
great to have,
cycle.
I
What
suppose,
might
outcomes,
we
it's
might want to
really
change
also that for
course, and
families
is that
things can be
okay?
really complex.
So having
And
something
it's not as
much more
straightforward as we
dynamic
move to it before and
in
after.
that regard.
Sometimes it
Obviously
can
not
be, but not
changing
for
every
everybody.
week or every
And how
month,
do we
but
really
you know,
go into
really
that space
genuinely
where we learn
listening
in our
and looking
practice
at
and
what
that
we're
together as
learning,
well?
and
That
then are we on
absolutely
the
we
right
want to
track,
have the
and do we need
outcomes,
to change
but also
anything?
trying to hold
And I
that
suppose when we're
systemic
thinking
practice
about,
piece at
I'm
the
just
same
going to
time as
finish
well.
now,
So,
thinking about
so that's
kind of
something that we're going to
that
talk more
data
about in the
collection
next
and
session
change.
around
It's
these
worth
kind of
thinking
cultures
then
of
about
learning. But it
where
was
does
just to
that
kind of
data
open up
trail
that
start? And we're going to
conversation
again spend
today
more
as to
time
how
on
do
this
we hold
next
outcomes
week.
absolutely as
But
at
when
that
we're
higher
thinking
level
about
and
are
that
we making a
systematic level,
difference,
but how
we
do we
also
also
need
think
to
about it at that
look back,
systemic
and
level, and
obviously
how
we
it
have to collect a
integrates into
range
our
of different
practice and
data,
what we're doing,
and
and
that's
how we
where, as
learn
leaders
together,
and
whether we're
managers and
funding programs,
coordinators,
whether we're delivering
creating the
programs, whether
right
it's home visitors on the
culture
ground and
around
with
that
them
is going
for
to be really
families as well.
crucial,
How do
and
we
how we
hold
do
all of
that
this
and
with
do
them
that
too?
well,
So
that is
I'll hand you back
transparent
over to
and
Susan.
honours, and
That's great, Louise. Thanks so much. And I think you'll probably see that we're trying to really support and especially by engaging with yourselves as our leaders in home visiting and having our colleagues from TUSA and the HSE
in
here,
an ethical
how we
and
really
in a
want to create those
way,
cultures of learning,
and that involves
that
our home
outcomes are
visitors
really
asking questions.
helpful in
And
that
I
regard.
guess that's
And
really
I think
at the
those
core of
slides,
this
Louise shared
is
with us there, kind of
and
really
how
try and
we
demonstrate
support the
that.
culture around this is
And I
really,
suppose just
this is
as we're
the real
finishing up
pinch
before we
point,
do questions
and how
answers,
we
I suppose just
support
to
our home
bring
visitors
some of it all
and
together,
support them in their
these are
practice
questions that are
and
posed
enable
by
them
both with
outcomes-based
confidence
accountability,
and
kind of
I use the word
some of that sort of
transparency as well,
ongoing learning
in how we
cycle.
work
And,
with parents,
you know,
and how
one
some of
thing,
those questions
as we're
are
setting
interventions in
outcomes,
themselves.
and I would challenge
But
you maybe
if
all when you
parents
come
are
off the
open
call
to
and you think about it with your
sharing
team,
that information with us,
and it
how we
actually
can
can be a
learn
really hard
in
question to
bigger,
ask
more
is what is the
contextual
problem
way
we're
as a
actually trying to
team,
solve
how
here?
we can share
and nobody likes to frame things in the negative. One parent and one home visitor, things can change. But we are funded to deliver a service for a particular reason, and often we're so busy doing as leaders and managers and coordinators and so on that it can actually be hard sometimes to actually sit down and think, what are we trying to actually achieve, as it were. And that's what really helps us inform our outcomes. But more than that, it's useful to them to think about. Well, then obviously we're on a journey here, and the next session we're going to move forwards and look at end on how we can start measuring that. The series is that hopefully the series that you binge watch and encourage you to come back for more in the second session. Is that a real change for the person, or people will reflect? But for now, I'm going to show that change and collect some information on it for questions and answers. And I suppose what will be helpful say is that also we are not by no means the experts. The expertise is very much within the room. The national indicators, which are really helpful to see how are we actually doing. So how can we track these things? But also essentially, who are the people and the partners who we need to work with about this? Someone within the room hopefully might have an answer as well, establishing what our outcomes are, but also in delivering them. And we would include our families and our children.
Anyone want to?
In terms of that, how can we set our outcomes if we don't have any all our partners, at the same time, be great if anyone with them, or even some comments. We've Caroline been mentioning, we can't be solely responsible for achieving certain outcomes, and
the Home Visiting Alliance
we are part of a bigger system.
I just wanted to acknowledge
these
and
are all
praise the work.
Questions then that, as Louise mentioned there, that we want to create that learning cycle. What might we might want to change course, and is that okay? So having something really much more dynamic in that regard. Obviously not changing every week or every month, but really genuinely listening and looking at what we're learning, and then are we on the right track, and do we need to change anything? I mean, it is a challenge with the jargon. Thinking about, I'm just going to really get lost thinking about kind of that data collection and change. It's worth thinking then about where does that data trail start, and we're going to again spend more time on this next week. But when we're thinking about are we making a difference, we also need to look back. That's great. Obviously, we have to collect a range of different data, and that's where, as leaders and managers and coordinators, creating the right culture around that is going to be really crucial. And how we do that and do that well, that is transparent and honours and is includes parents and children as well. But to collect that range of data, we need to ask parents to share their information with us. And in an ethical and in a consensual way, and that involves our home visitors asking questions. And I guess that's really at the core of this is and how we support the culture around this is really this is the real pinch point. And how we speak to some of that, Emma, just in terms of the work we've done in their practice and enable them both with confidence who weren't aware. I use the word transparency as well. In how we work with parents and how some of those questions are interventions in terms of kind of. But what would you want from the program? And we ask questions. I think it's really helpful how we can learn really in a bigger, more contextual way. What training should a home visitor have? How we can share our, even the practice of from between one parent and one home visitor, things can change. How frequent should the visits be? What focusing in what information should they share? What we require as leaders and managers, and coordinators to support home visitors and support our teams. One was really really reassuring was we were all on the right track and we were delivering a lot of that, and I can certainly more than that send a link into that document into their practice. We didn't. We kept it fairly short in terms of feedback because we wanted end on that to be quite. This is like the series, so we can certainly share that around. The series that you binge watch, Emma, and encourage you to come back in terms for more in the second session. And I think where we can delve into maybe to your broader point is that we need to continue. But for now, I'm going to stop the sharing the presentation, and we have making lots of time for questions and answers. And I suppose what I just might want to say is that we are not by no means the experts. The expertise is very much within the room. So if people do have any questions or answers on anything that we've talked about today, please do. It's very hard to you find many parents who haven't actually experienced it within the room who have no idea what it is. So it's hard to know how to manage that consultation as well. But yeah, I see Louise has her hand up there as well. Louise, you might want to answer that better.
No, I think I just wanted to add something else.
Delighted
as well.
if we don't have any wheel. But at the same time, it'd be great if anyone
work with mothers
or even some comments. Caroline,
and there has been some research internationally around home visiting programs
and the Home Visiting Alliance in that space.
And what came out a lot was the emotional support that was provided in home visiting programs and the relationship.
The simplicity
so I think
of the language
particularly when you're working with families that may be marginalised from supports, there is literature out there that I think we can learn from as well.
To think into how we ask questions and what we're trying to do and keeping it really simple. So thank you so much for this morning. Really appreciate it.
To be a parent, but also to be a human being in their own right.
Thanks, Caroline, for that feedback. That's great. Yeah. Yeah, and I think there is a challenge with the jargon. Others would agree. You can really get lost in it all.
Having a one-size-fits-all approach is definitely not the way to go. And so when you do ask parents about what it was they felt was important for them in their home visiting program, you'll get different answers.
Great.
So that is the challenge. So having a framework that can flexibly respond to each unique context and need is really important. I mean, people have mentioned social isolation. That came up once, or that came up a lot in some of the feedback we got, and certainly a lovely phrase, which is that my home visitor is a community in herself. That having that person come in once a week was so valuable and important. For someone else, it might have been around advocacy and empowering them to become their own advocate, or having someone who really was on their side. Someone else might have been more mental health issues, and particularly a common one was a number of families with children with additional needs, and just even navigating that system. So
I can speak to some of that. I think that's probably one of the great successes, and all of you around here are leaders and coordinators of home visiting programs families who weren't aware of that feedback. But then we consulted with those families who received it. We did ask some of those questions in terms of kind of, what would you want from the program? And we asked questions, and I think it's really helpful. They were really I'm just going to quickly share what we're going to do. What training the next session, and then so what we're hoping to address how long next session should it last. Is really a greater focus on data collection. Should they share? We're not going to go. We'd love to spend. Many people have mentioned measures there today, like the top C. One was really really reassuring. Was we were all on the right track, and we were delivering a lot of that. And I can certainly send the detail of all of those. But we're definitely going to have an experience. We kept it fairly short in terms of feedback, because we wanted it again to be quite a parent-friendly document. But we can certainly share that around. A little bit more time talking about working with parents, and just in terms of again inviting yourself to consider how we might support staff. Maybe to your broader point is that we need to continuously and then asking yourselves as well more, and not just have a think about it. Sure, we're asking it of all families, because different families in your role as a leader or manager to support that obviously culture of learning and inquiry, because it does take time to unite have the time to analyse things, to look at things, engagement to step back. And it's very hard. You find many parents who haven't actually experienced a home visiting program have no idea of what it is. So it's hard to know how to manage that consultation as well. But I see Louise has her hand up there as well. Presentation. You might want to answer that better. So a link for the next session. We will ask you to register again. Michelle, just jump in if I'm forgetting anything.
I'm also doing work with mothers in addiction
presentation. Just to flag, Louise, I'm sure we can share. There is training available. I'll put that link in that space on human learning systems. I'll put that link in the email as well. That's free training, and that's something that certainly the child poverty and wellbeing unit within the Department of Antiship have been looking at. So if anyone's interested in learning more about that, we'll put that link in as well. But otherwise, we hope you will all join us again. And I think certainly, which is 11 to 1 again. But what we found is that 22nd, skipping having Friday, a one-size-fits-all approach is definitely not the way to go. And so when you do ask parents about what it was they from the breakout felt was important for them in their home visiting program, you'll get different answers. And that is the challenge. So having a framework that can flexibly respond to each unique context and need is really important. I mean, people have mentioned social isolation. That came up once, or that came up a lot in some of the feedback we got, and certainly a lovely phrase, which is that my home visitor is a community in herself. That having that person come in once a week was so valuable and important. For someone else, it might have been around advocacy and empowering them to become their own advocate, or having someone who really was on their side. Someone else might have been more mental health issues, and particularly a common one was a number of families with children with additional needs, and just even navigating that system. So
So I think that's probably one of the great successes, and all of you around here are leaders and coordinators of home visiting programs, to be so proud of that feedback. But that I think, you know, it can be very different. But yeah, no, that's a great question. Okay, anything else there from anyone? Great. Well, I'm just going to quickly share what we're going to do at the next session, and then so what we're hoping to address next session is really a greater focus on data collection. We're not going to go, we'd love to spend, many people have mentioned measures there today, like the TOPC or parental stress, child-parent relationship measures and scales. We won't be able to go into all the detail of all of those, but we're definitely going to have an experience from the field on how home visiting programs have addressed that. Spending a little bit more time talking about working with parents and again, inviting yourselves to consider how we might support the staff, our home visiting teams, and then asking yourselves as well more, and you can have a think about it, what you need in your role as a leader or a manager to support that sort of culture of learning and inquiry, because it does take time to have the time to analyze things, to look at things, to step back and to work with your team and share that learning back with your team. So really to have a look on all that at the next session. And in the meantime, we will be sending out the presentation so a link for the next session. We will ask you to register again. Michelle, just jump in if I'm forgetting anything.
No, you're grand.
Send you out the presentation just to flag, and Louise, I'm sure we can share it. There is training available. I'll put that link in on human learning systems. I'll put that link in the email as well. That's free training, and that's something that certainly the Child Poverty and Wellbeing unit within the Department of An Taoiseach have been looking at. So if anyone's interested in learning more about that, we'll put that link in as well. But otherwise, we hope you will all join us again for the second session, which is 11 to 1 again, Friday 2 weeks, so the 22nd, skipping a Friday. But we'd love to see you all back again. And thank you so much for your participation and your feedback from the breakout rooms. That was excellent. So thanks very much, everyone.